I'm Rick McGuire. I'm the executive editor of CardioSource WorldNews, and I'm at the Cardiovascular Care Summit in Las Vegas. And I'm talking with Dr. David May, who's one of our ACC governors for the great state of Texas, and also president of a practice. Dr. May, one of the things you were talking about here with Dr. Brush included the whole topic of data and why we need it and what we do with it, I guess. Let's talk a little bit about that. What were some of the points you were trying to make?
Well, I think that the issues that are going to exist are that data collection is going to happen.
Whether we like it or not.
Whether you want it to be done or not. And I think the data collection is going to move from hospital to office-based, and it's going to move from a sampling of your data to a large amount of it. Think 80 or 90% of your patient load. The talk with Dr. Brush and I was to answer questions, why do you collect data and how do you collect data? Collecting data is oftentimes confused with extracting data from a medical record, for instance, and they're really different things. The physician is responsible for, should be engaged in the process of the data collection. It's imperative that they understand what they're doing, what the metrics are, and how the flow needs to work to get all the data pieces. We then let the IT folks get it out of the data system for us and send it off to wherever repository it's going. And that was really the focus of the talk today.
I think we've gone from where we have hospital data to draw from to where cardiologists are looking at this thinking that it's hostile data, that this is just not going to make their life any easier and it's probably going to complicate things. Is the data you're talking about hostile? Should we be a little bit friendlier towards this data? What kind of an attitude should we have for this stuff?
You should take ownership of your data first and know it's not hostile data. It's really what you're doing. It's important to recognize that the hospital data is almost always episode of care data. It's a single encounter. Hospital data, therefore, represents a snapshot in time, a photograph. Office data, outpatient data, is longitudinal, and it allows us to look at things like progress towards goals, achievement of certain metrics. So the data are not hostile, the data are not evil, the data are your data. Make sure they're good, make sure that they are accurately reflecting what you do, and for goodness sakes, help them collect the data because it's in that process that you demonstrate quality. We are going to be measured on quality, and we are going to be reimbursed, at least in part, on quality. So it behooves us all to make sure that the data is good.
And how do we do that? How do you go about making sure that the data is good and that collecting it, of course?
I think that the way that you make sure your data is good is three things. First off, you are compulsive about making sure that you collect the data in a reliable fashion. Don't let it be a random process, gee, I do good care when I remember. That's not a good approach. The second is to review your data, periodically assess where you are, take corrective action. And the third is really try to follow the guidelines-based strategies and appropriate use criteria that the college has put forward, because those are the metrics, like it or not, that have been adopted by the vast majority of the third party.
Everybody wants to live in Lake Wobegon where everybody's above average. If you get a number back and then you're not as high up as you would think that your practice should be, what does that tell you? Should it depress you?
No, it should not depress you. You should do at that point a couple of things. First, assess what has gone wrong. Do the data accurately reflect what you're doing, or in fact, did the data collection process not reflect what you're doing, a systematic error? And secondly, put into place those strategies, those protocols, those treatment plans which make you achieve those targets. If you shine a light on it, it'll get better, is the mantra that we all use.
Well, the point, too, is that that's good news because it gives you some idea of where things can be improved, where may have gone wrong, and it gives you an opportunity to shine that light on it and hopefully make it better.
That's exactly correct. The data collection process, although sometimes seems painful, really lets you look at what you're doing, and it's the result that is important. The improvement that occurs in care when we look at the data is phenomenal. The door-to-balloon time success is an example of exactly that.
So remember, it's hospital data, not hostile data. Dr. May, thank you very much. I appreciate your time.
Thank you.